Good afternoon. My name is Gabby Love. This is our project, Dysphagia Treatment Competency Service Learning Project. Everybody else introduce yourselves.
Carson Pope.
And I am Chandronica Singleton.
And my name is Avery Celestine. So our assigned recipe was the root beer float, and it's at the level 2 consistency, which is the nectar mildly thick consistency. So we'll be demonstrating how to make this root beer float for you today. First thing you need is your thick and easy cup. And you're gonna take your ice cream and root beer and add it in the cup.
And for this project, we are using a recipe from the Hormel website for the root beer float.
Okay, so after you put your ice cream and root beer in your cup, you're going to add your level 2 mildly thick thickener. And this is a clear thickener, by the way. So I'm using the whole pack. You can use however much you think will be satisfactory for your client.
But for this project, we are using level 2, which is 1 packet. And that is what we were assigned to do, is level 2, which is 1 packet.
So now we're just going to take this and mix it up. Give it a good stir. You want to make sure that you blend in the thickener all the way. Okay. This is a pretty good consistency. So now I'm going to taste it. Okay, my initial thoughts are that, in all honesty, the consistency of the root beer float really doesn't taste that, it doesn't feel that different. It feels a little thicker, but not much. And the flavor, honestly, is the same. In terms of the color and the smell, it's the same color as a normal root beer float, light brown, kind of on the cream side. And then for the smell, it just smells a little bit sweeter than normal.
Nice. And I like how it looks like a root beer float. It doesn't look like anything different. It doesn't look like it's thickened. It just looks like a normal root beer float.
Yes.
And so for our next part, we put some likes and dislikes based off of what we thought that we may like and dislike about it. So some of it, obviously, we were correct on, but we had dislikes that we didn't think we were going to like the consistency because it would be a lot thicker than normal. But as Avery said, the consistency didn't seem any different. So we added that in there. And then we also added some recommendations for patients with a swallowing disorder. So if anybody wants to name 1 or 2 of those.
And you want to take it over?
Wait, we can't hear you, Shan.
Sorry, y'all.
Okay.
Recommendations for patients with swallowing disorder. Eating 6 small meals a day versus eating 2 larger meals a day can help improve your swallow. Another recommendation would be enjoy your meals, research different recipes to use with thickeners to increase quality of life. And overall, just make sure you're chewing on the strongest side of your mouth. These are recommendations for a patient with swallow.
And for these recommendations, especially for the first one, eating 6 small meals a day will help strengthen the mouth muscles that are required for the swallowing mechanism. And that's why we say eating 6 small meals, or even a bunch. It doesn't have to be 6 small meals. It can be 8 small meals, or it can be 5 small meals. As long as you're eating throughout the day and using those muscles, it's best to use the saying use it or lose it, because if you don't use your swallowing mechanism, you're going to lose it. And for chewing on the strongest side of your mouth, for some swallowing patients, they have one side, especially like in head and neck cancer patients, one side of the mouth is going to be a little bit weaker, and we don't want pocketing of food on one side of the mouth, so you use the strongest side of your mouth. And for the last one, just enjoy your meals. You want to live your life. You want to try everything that you can to make your life as best as you can. So enjoying the meals that you like, finding recipes that you can use with thickeners is the best thing you can do.
And then we also made a infographic or a pamphlet to hand out to patients who have swallowing disorders. This just states our recommendations that we think are important and positive towards the to a dysphagia client. So this is just a fun little handout that that we made.
And we will include that with our final presentation submission.
And overall, we just hope that by demonstrating doing this recipe, we're showing clients that you don't have to sacrifice everything that you like to eat. You can still enjoy your favorite things, and your quality of life can be improved. You just have to find different alternatives for some of the ingredients.
Yes. And that's our project. So thank y'all for watching, and thank y'all for following along with us as we did this.
Thank you.
Thanks.
Thank you.